Hi Ian, my name is Kelly and I'm going to be your provider today. I understand you're here for a physical exam. I was told that your vision is 20/20 and that your vital signs are normal.
Yes.
Do you have any concerns that we'd like to discuss today while we're here?
Nope.
Okay. So I'm going to go ahead and start with from head to toe, and I'm going to do a physical exam on you. I'm going to start by looking at your skin of your face. There doesn't seem to be any deformities or anything along that line, no masses or lesions. Your ears look level as well as your eyes. Let's go ahead and just start by letting me touch your head. I'm just going to check for any kind of bumps or bruises or moles. It actually looks, you have a few flat moles, but they look pretty normal. I'd like you to go ahead and follow me with some facial expressions. I'm going to start looking at your cranial nerves, okay? I'd like you to smile for me, frown, puff out your cheeks, wrinkle your forehead, stick out your tongue. It kind of seems funny, doesn't it? All right, well, I'm just checking your cranial nerves to see how well they work, okay? I'm going to start by looking at your eyes. Do you wear glasses?
Nope.
All right. So first off, I'm going to check to see how well your eyes respond to light. If you'll go ahead and just look at me, and I'm going to shine a light in your eyes, and just try not to look away, okay? So what I'm looking to see is if your eyes, the opposite eye constricts when I shine the light in the other eye, and they do. You have great response in your eyes. Now I'm going to take my otoscope, and I'm going to look in your eyes, and I'm going to check to see if I can see the back of your eyes. I'm kind of looking at the vessels to make sure that everything looks healthy. So if you'll just go ahead and look straight ahead, I'm going to look in your eyes. Good light reflex, nice and red, just the way that it's supposed to. That doesn't mean there's anything wrong with it. It just means that you have a good light reflex on that side too. Those look pretty well. All right. Let's go ahead and I will go ahead and go down to your ears. You don't have any piercings, which is great. Your ears are level. They don't seem to have any kind of lumps or bumps on them. I'm going to go ahead and look into your ears and see how your eardrums are. Did you ever have tubes as a child?
No.
All right. So I'm going to go ahead and look in your ears. Your eardrums are clear, free of wax. There is a good light reflex at 5 o'clock. Your eardrums are pearly gray, which is exactly how they're supposed to be. Nothing bulging. Same with this side. Everything looks great in there. No signs of infection. It'd be kind of fun if I could see the inside of your ear, but I really can't see past that eardrum. But everything looks so far so good. I'm going to do what's called the Weber and Renee test. It will tell how well you hear. I'm going to take, this is a tuning fork, I'm going to take it and I'm going to tap it and I'm going to set it at the top of your head. And I want you to tell me if you hear it equally on both sides or one side or the other side better, okay? How do you hear it? Both sides. Great. That's a good answer. That's the way it's supposed to be. All right. Now I'm going to take and I'm going to tap it again. I'm going to do one ear at a time. And I'm going to let this sit on your bone. And I'm going to have you let me know how long it takes before you don't hear it anymore, okay, or feel it anymore in your ear. And then I'm going to move it in front of your ear. And then I want you to tell me how long it takes for you not to hear it again, okay? Here it goes. Okay, so you heard it at 6 seconds and 18 seconds. That's very appropriate for the response. Let's check this here. All right. So your air conduction is greater than your bone conduction, which is the way that it's supposed to be. Everything's is great there. All right, next I'm going to look at your nose. I'm going to try to visualize the inside of your nose without causing too much trauma. You ever had any problems, any nasal surgery or anything along that line?
I had no surgery.
You had no surgery?
8.
How come?
I took a bat to the face.
Oh my gosh, I bet that hurt. Okay, well I'm just going to go ahead and look. It doesn't feel like there's any lumps or anything like that. Just going to look in your nose. I can see your sinus. I can see your turbinates. They look clear. No redness. Let's try this side. Same thing. Looks great. All right. So I'm going to go ahead and inspect next inside your mouth. I'm going to look at your teeth. I'm going to look at your gums. Look at your tongue. Make sure that there's nothing that has any lumps or bumps or anything along that line in it. A lot of times we don't notice anything unless we're brushing our teeth or there's something painful or something bleeding. So I'll just look to see if everything is okay. So go ahead and just open your mouth. Everything looks pretty good. Gums are nice and pink. Oral mucosa is very moist. That's great. Roof of the mouth is intact. So go ahead and stick out your tongue and say ah. Oh, tonsils are absent. Okay, so that's great. You had your tonsils out. That's wonderful. I'm going to go ahead now and touch where your sinuses are on your head. Or excuse me, not your sinuses. Well, I'll touch your sinuses first. So the first sinuses that I'm going to touch, these are called your temporal sinuses. Any kind of pain there?
Nope.
Ethmoid sinuses? Maxillary? Any discomfort? All right. Now I'm going to check your lymph nodes. We have a lot of them, a lot more than you would think that we would have. The ones in the front of your ear are called the preauricular, and they're great. There's no lymph nodes there. Post-auricular, those are good too. We have the tonsillar, cervical, submandibular, submental. I don't feel any. All right, so while I'm here, I'm going to go ahead and check, make sure that your trachea, that's where we swallow and breathe through that area, that it's aligned correctly. Just kind of bear with me here for a second. It's midline, it's center, it looks great. Now I'm going to go ahead and check for your thyroid, okay? I'd like you to go ahead and swallow for me. Any discomfort when you do that? All right. We have some major arteries that run up and down our neck. Those are our carotids. I'm going to take and listen to them. I'm listening for any kind of whooshing sound or a sound that shouldn't be there. What I want you to do when I'm ready is I'd like you to go ahead and take a breath and then hold it while I listen. I'll do one at a time. Ready? Go ahead, take a breath and hold it. I don't hear any. Go ahead and breathe. Don't hold your breath any longer. I don't hear any thrills or rushing or anything along that line. Go ahead and take a deep breath. Let's do the other side. Everything sounds great there too. All right, now I'm just going to listen to your thyroid a little bit. And you can breathe, please. And a lot of times we're listening for any kind of abnormal sounds that would be going through that area. All right, so now let's start from the shoulders down. I'm going to do a little bit more of your testing of your cranial nerves. I'd like you to shrug your shoulders, pull them up, okay? I want you to take your arms like this, and I want you to push against me, pull back, great. Now I want to check to see how well your neck works, so if you'll just go ahead and turn from side to side, as far as you can go to the left, as far as you can go to the right. Any discomfort with that? Can you lead your head forward? Lean it back a little ways? Any problem with that? Okay, this time while you turn your head, I'm going to put my hand there, and I want you to turn your head against my hand. Go ahead. Good job. Again. Okay, now I want you to try to lay your head down on the side. Okay. Muscle strength is wonderful. You must be working out a lot, right?
I'd say so.
Okay. Have any questions for me so far? All right, let's just take a look at your arms since I got you here out front. No skin abnormalities, no open wounds. Everything looks to be intact. Other arm also. Okay, this is what I want you to do. I want you to do, first off, I want you to take your hands and place them on the tops of your legs. And then I want you to turn them over as fast as you can. A little faster. All right, just checking your coordination. You did a great job. Hand-eye coordination is great. Okay, now I'd like you to take your fingers, and I want you to take your thumb and your pinky, hold them still, and I'm going to try to pull against them without breaking them. Good job. Okay, can you do this really quickly? You know, a lot of people can't do that, so that's great. All right, now what I'm going to do is I'm going to do an exam, listen to your back, your lungs, check out everything. Can you go ahead and remove your shirt from me, please? Thank you. All right, maybe we can move forward just a tiny bit, just so I have room here. Perfect. All right. So I'm just looking right now just to make sure that there's no moles or anything that's abnormal on your back. I'm going to be looking at how well you breathe, if everything goes and moves the way that it's supposed to move when you're breathing, and then I'm going to go ahead and listen. So first off, I'm just looking to see how everything is. I'm going to do what tells me is expansion. I'm going to see if your lungs expand at the same time. So I'm going to put my hands there, and I want you to go ahead and take a deep breath. Good. Go ahead and relax. One more deep breath. Perfect. Very good. Now, one of the things that we do is we check to see the location of where your diaphragm is, and I'm going to go ahead and check that. So I want you to go ahead and breathe in, breathe out, and then hold your breath. And I'm just going to tap until I hear a dullness. Okay. Now I want you to go ahead and take a deep breath. Go ahead and breathe a couple times so that you don't feel like you're going to pass out. Take a deep breath and hold it. And then I'm going to tap again from the top to the bottom. And what that does is that tells me about how far your rib cage expands when your diaphragm moves up and down. It's kind of a cool thing. All right, 9 centimeters, perfect. I'm going to also go ahead and tap where your kidneys are. Can you move forward just a smidge? Thank you, sir. I'm going to tap where your kidneys are, and I want you to tell me if you feel any discomfort, okay? Any discomfort at all?
Nope.
Great. All right. I'm going to take a listen. Oh, let me do one more thing. I'm going to check to see how well your lungs get air through. And I'm going to take my hands and place them. And every time I place them down, I want you to say the word 99. Okay? Ready?
99.
Again.
99.
Again.
99.
One more time.
99.
Perfect. No consolidation. Everything seems to be great. You know, it's kind of a muffled sound that I feel when you say that, and that's supposed to be normal. All right, now I'm going to go ahead and listen. Each time I move my stethoscope, would you please take a deep breath? Left upper lobe. One more time. That sounds great. There's no wheezes, no bronchi, very clear. Let's do it on the other side. You getting lightheaded yet?
Nope.
Okay, good. Your lungs are great. Respirations are even, unlabored, no wheezing, no bronchi. All right, so now I'm going to go ahead and move around to the front. And I'm going to do the same thing with the 99 on your chest. And if you'll go ahead and just go ahead, each time I move my hand, say 99.
99. 99.
Does it feel strange?
Nope. 99.
Okay, perfect. Now I'm just going to go ahead and listen in the front. You just breathe normal, okay? Okay, sounds really good. All right, are you pretty athletic? Any shortness of breath when you're exercising? Problems going upstairs? Anything along that line?
Nope.
No asthma or any kind of family history of asthma?
My brother Cameron had childhood onset asthma.
Okay. But you never got it, right?
When I got chickenpox, I was on an inhaler. But other than that,
okay. All right. Well, let's go ahead and listen. I'm going to listen to your heart now. What we try to do is we try to make sure we can tell which part of your chest where your heart's sitting. We listen to 5 different areas, and so I'll go ahead and start with that first. The first area we listen to is apical. Aortic. Pulmonic. Herbs. Tricuspid. And mitral. I don't hear any murmurs. I don't hear any gallops. S1, S2 sounds perfect. Okay, so I'm going to put my hand and I'm going to see if I can feel your apical pulse. Okay, this is the base of your heart. And a lot of times, especially on someone as slim as you, I can touch it and actually feel your heart. Okay, we can touch it in several different places. We can touch it on the base, the apex, or the internal sternum. Great. Everything feels great there. I'm going to go ahead next and have you move over to the bed for me. I'm going to move this chair out of the way and lay down and get yourself comfortable. Doesn't matter to me. You have to get your legs up on the table though, so if you'll slide back a little bit, that would be great. Can you move over this way for me so I can reach you? Perfect. All right, so now I'm just going to look. I'm going to look at your abdomen, make sure that there's no lumps or masses or anything that I can see that's sticking out. A lot of times we look for pulsations. It looks pretty good. Next, I'm going to listen. We listen in all 4 quadrants to make sure that we hear active bowel sounds, which I do. Not hyperactive, but they sound pretty active to me. I'm also going to listen to your aorta. I'm going to listen to your renal. Okay, now I'm going to just do some light palpation. Just going to see if there's any tenderness. Let me know that if any of these areas that I touch are painful. And then we're going to check for your liver, and we're going to check for your spleen, okay? So on this side of your body, which is your right side, I should be able to feel your spleen. I'm going to put my hand underneath you. I want you to go ahead and take a deep breath and hold it for me. And I'm going to see if I can feel your spleen. Yep, feels pretty good. Okay, now I'm going to do the same thing for your liver. Go ahead and breathe a few times. And then I'm going to go ahead and check your liver. Any discomfort when I do that? All right. Then I'm going to check for your kidneys. Now, I know it kind of seems funny, but if I put my hand back here and you just relax, I can go ahead and try to see if I can feel your kidneys. Yep, there's 1. There's 2. Any discomfort when I've done that?
No.
Okay. While I'm here, I'm going to listen to your inguinal and femoral arteries. You have lymph nodes there, and it doesn't seem to be any problem with your lymph nodes. Okay. All right, so let's check a little bit on muscle strength, okay? I'm going to go ahead and just see how your hip joints are. I'm going to lift your leg up. Go ahead and relax. Just relax it. Any discomfort with that? Okay. Anything there? All right, let's do the same thing with the other leg. Go ahead and relax. Any discomfort? All right. While I'm sitting here, I'm going to check your popliteal pulses. I'm going to check your dorsalis pedis pulses and your posterior tibial. Any problems with edema or swelling in your legs?
Nope.
Okay. So I'm going to have you go ahead and sit up for me. I have one more thing that I need to have you do. So if you want to sit back in the chair for me, I'm going to check some reflexes. All right, so just go ahead and relax. I'm going to check first off your brachial reflexes. Just going to go ahead and have you rest your arm there. And what we're doing, we're just checking to make sure that your nerves are talking correctly to the rest of your body. And we could check the one here too. This is called an ulnar one. All right, and then the reason I put you in this tall chair is because I didn't want your feet to touch the ground, okay? So I'm going to check your knees, check for a reflex. And then I'm going to do your posterior tibial reflex. Okay, so I'm going to check some sensation on you. I have this paper clip, and one side is smooth, and the other side is sharp. I want you to close your eyes, and I'm going to touch you several places on your body, and I want you to tell me if you feel smooth or sharp, okay?
So smooth. Smooth. Sharp. 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 Smooth.
It's a test, you know.
Smooth.
Okay. All right.
Sharp. Sharp. Smooth.
And I'm just checking to make sure that your sensation is intact, which it is. You've done great with that. I want to go ahead and I did that. Okay, so go ahead and stand up for me. I'm going to do the last thing I'm going to do is I'm going to check to see if your spine is straight. If you can go ahead and turn around for me. I'm just looking to make sure that everything is in alignment, that everything is. You might want to come forward just a little bit so you know our back so your head doesn't hit. And I want you to go ahead and bend over at the waist.
Oh, okay.
I just want to see everything is straight. There's not any raising in your hips. Everything looks good there. Go ahead and stand back up again. I want you to go ahead and turn. Oh, sorry, I'm out of the picture. I want you to go ahead and turn. Bend side to side for me. Okay, the other side. Now, I want to check your balance. So, feet close together. If you want to put your arms out, you can. I want you to close your eyes. It doesn't matter. Close your eyes. And I want you to stand there and see how your balance is. We do that for about 10 seconds. Okay, now I want you to stand on one foot. You pick. It's your choice. Stand on one foot. All right. Great on your balance. All right, go ahead and have a seat. So, I forgot to have you do something for me. I want you to show me that you can walk on your heels and walk on your toes. Okay? You know, some people can't do that. Go ahead, stand on your toes. All right, perfect. Go ahead and have a seat. Well, you know, everything seems to be pretty good today. I I see that you don't have any masses or anything like that. Your skin looks great. I haven't found any suspicious moles. Did you have any discomfort in anything that we did today? Any
No.
dizziness? All right. So I think that's the end of our exam. Thank you for letting me have a chance to take care of you today.
Thank you.